Hi, you're watching Cape Media News. I'm Gabrielle Rosson. I'm here today with Dr. Priya Patel, who's a veterinarian and medical director at the New England Wildlife Center. And I'm also here today with Zac Mertz, who is the executive director of the Cape Cod branch. Welcome to the show, you guys.
Thanks for having us. Hello.
Hi.
Absolutely. Thank you so much for being here. I follow you guys on Facebook, and I saw a story about an owl who had apparently been poisoned by rodenticide. And I thought, I was looking through some of the comments, and somebody said, like, this is an opportunity for education. You know, are there any alternatives? This is really sad that this is happening to these beautiful animals that are actually part of the solution to rodents, rodent control. And so I said, well, let's bring you guys on the show. Let's talk about this. So talk to me a little bit about the owl himself or herself, and then let's talk a little bit about alternatives to some of these poisons, if possible.
Sure. So if it's okay, let me give you the quick background. And then as Priya is the veterinarian who's actually actively treating this owl, she's going to be able to give you a lot better overview of his case and what we did to help turn his condition around.
Perfect.
So at the New England Wildlife Centers, we run two hospitals, one in Weymouth and one on Cape Cod. And both of our hospitals admit quite a few patients with suspected rodenticide. And we say suspected because in order to confirm this, you usually need a tissue sample, which is something that's hard to get when the patients are recovering, or usually it's easier if they're deceased. So most of the cases we treat, we have a very strong suspicion and some diagnostics that point us in the direction of rodenticide. We're not always able to say definitively that's what's going on. Nevertheless, we get patients pretty much across the spectrum of local species, meaning we get birds of prey like hawks and owls. We are also starting to see rodenticides affect things like raccoons and foxes and sort of mesocarnivores. So this is a really persistent and widespread problem that affects our whole ecosystem. And rodenticides are a complicated topic. I'm going to be honest with your viewers and listeners. This is a subject you're going to have to do your research about if you need to do rodent control in your own home, because there's a lot of different types out there that do a lot of different things that affect a lot of different animals. So it's important to know not only what animals are living in your backyard, but also which solutions are going to be right for you and right for the environment that you're in.
Okay. So Priya, talk to us a little bit about this owl. Tell us about the condition you found him or her in, and how the treatment's going.
Absolutely. So the type of rodenticide that we think that he got himself poisoned with is something called anticoagulant rodenticides. And there's many different types on the market that affect the body in different ways. There's ones that affect the neurosystem, ones that affect the way calcium is stored in the body. But this particular one affects how the body can clot blood. And so if an animal ingests it either directly, meaning they eat the bait directly, or secondarily, meaning they eat a rodent that has eaten the bait, it causes their body to not be able to clot if they sustain an injury. And the injury can be very minor, but it can cause massive bleeding. And in this circumstance, the owl presented very quiet, almost not able to move at all, very shallow breathing, and with blood around the mouth and bruising all over the body. And while we can't test directly for that type of rodenticide, it's almost textbook clinical signs of how it presents. So this is what I suspected from the second it walked through our clinic doors. And so we started treating for that immediately. And because he was so critical, we went through some extreme measures. We placed a catheter within the bone of one of his wings because his blood pressure was so low, we could not get a catheter into any of his veins. But the bone has direct access to blood supply. So with that catheter in place, we could then give intravenous fluids and emergency drugs. And we also noticed that his blood was very thin. He was very anemic because he had been bleeding for so long. So we knew that an emergency blood transfusion would be his best chance of survival. And it's common practice to use blood from a similar species But that's not always possible, especially in wildlife when we never know what's going to walk through the doors. But blood from a species of, a similar species is also okay. And we happen to have an educational great horned owl that's very healthy, has been with us almost a year now. And so I performed a veterinary exam just to make sure that he was stable enough to donate blood. And we then took a small amount from him and transfused the barn owl that we have in care. And so that we did what's called a rapid bolus transfusion over 30 minutes, and then provided pain medications and vitamin K, which is almost like an antidote. It helps clot the blood while the poisons are still in the body. And then we're, crossed our fingers and hope that it would work. And by the next day, he was standing in his cage, which was amazing to see.
Yeah, I mean, you guys make such an effort to save the lives of these animals, which, I mean, obviously is its own reward to, save and protect these animals. But why is it so important to save these animals?
Well, we feel like it's a responsibility because over 90% of the reasons why we're seeing these injured and orphaned wildlife is due to some kind of negative impact from humans. So we feel like it's our job to sort of, clean up that footprint that we're leaving behind and help these animals that have no other resources.
Yeah, I mean, and to this, go ahead.
I was just going to add to that. And part of the reason we feel so strongly about treating these animals and providing free veterinary care is because it's an educational platform, right? People are never going to change what they're not connected to. So by making these cases visible where human wildlife conflict is occurring and causing problems, by making that visible and using it as an educational tool, that's where the real change happens. And so now it's not just within our hospital. We can broadcast this across the country on social media and our website, and people all over can benefit from the experience of this owl.
Absolutely. Yeah, it's he's not injured in vain, so to speak. But right. Let's talk a little bit more about rodenticides. And obviously, I know you can't endorse rodenticides, especially when you're actively trying to help animals that are injured from it. But what are there alternatives for people? I mean, owls are natural predators of rodents. Wouldn't people want owls around? I mean, maybe they do, and they're not intentionally trying to hurt these owls. But once they know that they can be killing these animals inadvertently, what can they do instead if they want to stop doing that?
Sure. So as you mentioned, owls in and of themselves are natural rodenticides. They are incredible rodent control on the ecosystem, as are a lot of the mesocarnivores we have, and things like minks and raccoons and local snakes, things like that. Those all have a natural effect on the rodent populations, which is great. But of course, when you live in a place like New England, where we live pretty densely populated and live indoors, we are going to get rodents. And we never want people to harm animals. We treat a fair of rodents at our hospital. But there are situations when people need to control the populations. And so we ask that when people do that, they look for the most targeted options out there. Meaning you're looking for either compounds and chemicals or devices like snap traps that are affecting only the target population. And so snap traps are not a terribly kind way to go, but at least they're only affecting that single animal. And if they're placed well in your house, there's a pretty low risk to other wildlife. The big one we're seeing when we talk about raptor safe anticoagulant, when we talk about raptor safe rodenticides, we're really looking at the ones that are not anticoagulants. There are a couple other chemicals on the market that studies have shown so far don't really bioaccumulate, meaning that once that rodent needs it, that dose is not going to get past the food chain to the next predator and the next predator. And so there is still some risk to other animals like raccoons, for instance. We're doing a study where we're looking at one called bromethylin, and we're finding it in raccoons. But you, as someone who's doing rodent control, you can have an effect and lower the risk. Meaning if you place those boxes and you place the traps and you place the bait in a way that's only going to be accessible to rodents, that's going to cut down on the risk in a big way. So as you can tell, it's a big, complicated issue. There's a lot of alternatives out there. You can go to the hardware store and probably pick out 5 or 10 different options with 5 or 10 chemicals that aren't going to make a lot of sense. But the one, if you could stop today using anticoagulant rodenticides, that would have a big effect on our environment. And it's probably going to protect the biggest amount of animals with one decision.
Wonderful. Now, if somebody watching this program has more questions for you, or if they find an injured animal, how do they get in touch with you guys?
Well, we are there 7 days a week at both of our hospitals. They can either call the New England Wildlife Center at 781-682-4878 or the Cape Wildlife Center at 508-362-0111. We're always there to help. The Cape has an after hours line. So if you have a late night animal emergency, we'll be there to help you. And if you have questions about rodenticides and you want to know what a safe alternative is for your situation, we'll always do our best to offer advice.
Wonderful. Thank you so much, Zac. And Priya, before I let you guys go, how can people learn more about this particular owl? Will you continue to be giving us updates?
Absolutely. We'll post, if we can, weekly updates as his progress. I can tell you today, I was able to take him out and do another quick exam, and he is bright, alert, eating on his own, was able to do an eye exam and everything looks normal, no palpable fractures. So he is progressing very nicely, and I'm very happy with how healthy he looks at this point.
Wonderful. And will you be releasing him anytime soon?
So unfortunately, as Zac mentioned, these poisons can bioaccumulate in the body, and our average time for treating rodenticide cases are about 3 months. It takes about that long for the poisons to be excreted from the body. We unfortunately don't have a medication we can give to bind to that poison and excrete it faster, but we can support the body with vitamin K and fluids as long as we need to. But unfortunately, we do have to wait for the body to excrete it naturally, which does take anywhere from, now 2 to 3 months. One time we treated a case for almost 6 months, and another case almost over a year. So it can take a very long time, but we're going to be there with him every step of the way.
Wonderful. I'm really glad to hear he's in good hands. Thank you guys so much for the work that you do, and thank you for coming on today's show.
Thank you so much.
Thanks for having us.